Hi everybody, thanks for coming along today. We've got a huge number of people signed up for today's session, so we'll just give it a few seconds and minutes actually till people get settled. So we'll probably start around about 12:03, so I'll see you very shortly. In the meantime, feel free to put a message into the chat if you wanted to say hello to everybody, and thanks for coming along. Hello, everybody. For those that have just joined us, we've got a huge number of people coming along today, so we're just going to give it a couple more minutes so people can get settled. Then we'll be starting very shortly. But thanks for coming along and speak to you soon. Okay, let's get started then. Thanks for joining us, wherever you are in the country. My name's Ross Gibson, Practice Development Advisor at the Children and Young People's Centre for Justice, and we run a number of webinars periodically through the year, and today we're delighted to have Dr. Charlotte Wilson, who's recently completed her PhD here at the University of Strathclyde, and she's going to be talking about some of the findings of her thesis. Charlotte is the Service Manager at Care Inspectorate for Children and Young People, and whilst her PhD was separate from her day job, there is a clear overlap between the contents of her PhD and her the work that she does at the Care Inspectorate. Charlotte's going to be talking to us about the experiences of children within the secure care environment with ASD, what that means for those children, and then for us to reflect as adults and practitioners what that means for the practice and how to support those children at the most acute element of the care system. So Charlotte's going to be talking for a wee bit. We're happy to take some questions at the end. As we go along, feel free to stick some questions or even some reflections into the chat, and we'll get through as many of them as we possibly can at the end. But for now, I'll pass you over to Charlotte. And Charlotte, thanks for coming along. Look forward to your presentation.
Thanks, Ross. Hopefully that's showing on the screen okay.
Yep, that's great. All good here.
Thanks. So I'm going to start just with a brief overview of the rationale and the methodology for the research that I carried out, and then I'm going to spend most of the time today focusing on the findings and finish with the recommendations for practice. I've got quite a lot to get through, but I'm hoping to have some time at the end to allow for questions. So thinking about the rationale, my research was set out to explore autistic young people's experiences of secure care in Scotland. It was carried out through engagement with Scottish secure accommodation services. We know that there's increasing prevalence of autism and increasing examples of autistic young people being placed in secure. The data from my research showed that across the secure sector, between 19 and 24% of young people were autistic, and per service, between 6 and 44% of young people placed there were autistic. There's been limited previous research in this area, as I showed in a publication in 2022, and other research is either now quite outdated, like Myers' research from 2004, or focused on adult settings such as Allely's work in justice settings or Murphy's work in secure hospital settings. I was keen to prioritise young people's voices, and I've included the voice of young people on the slides today, although I won't be reading out the quotes just due to time limitations. So thinking about the methodology, my methodology focused on young people's experiences, and I used a range of co-designed, flexible and creative methods to do this. I received data from young people in verbal, written and visual formats. I took a phased approach to the research, and that was carried out between June 2021 and May 2024. And across that time period, I engaged with 19 young people, although the data presented today was constructed with 7 young people. I reflected on some of the complexities of engagement in a paper that I published in 2024. I used the conceptual framework of looking at young people's experiences through the lenses of relationships, residence and rules, and that was based on Eamon and others' construction of a containing environment. And to analyse the data, I used Interpretative Phenomenological Analysis, or IPA. So we're going to move just straight into the findings now. So the findings showed 4 key themes which were all paradoxical, and I hope that you'll see today the strength of the data around young people's experiences of incongruence, dissonance and ambivalence. The 4 key themes that we're going to look at are care versus restriction, structure versus flexibility, nurtured versus scared, and belonging versus loss. Sense making, the power of the group and attachment were all strong themes that threaded throughout these. Due to Grandin's autistic cognitive types, I took a particular focus on visual methods in the research, and as a result, I developed a visual representation of the research findings, which you can see as a hopefully faint background to the slides, but there'll be a clearer image of this available towards the end of the session. I wanted just to recognise all of the names that I'm using today are pseudonyms. I used gender-neutral pseudonyms for young people to reduce the chance of them being identifiable. Young people were given the opportunity to choose their pseudonym, and 2 young people actually chose the same name, which is why there are 2 names the same, although I use a different spelling with an initial letter to make them distinguishable. I use identity first language, as this was the majority preference of the young people who took part in the research, and I use the term allistic to refer to people who are not autistic. So if we start with care versus restriction, home, ambivalence and staff skills were all sub-themes of care, and we're going to start by looking at home. Young people drew on the similarities and differences between life in secure care and life at home. For example, Sammy, who advised that the rules in secure care made the environment feel more like a prison and less like a home. Aspects of the physical environment that young people felt made secure feel more or less homely related to a combination of flexibility in the application of rules and provision of items that might commonly be accessible at home, but are often restricted in the secure environment. Andy referred to secure care as feeling more homely than the community setting they moved on to following their time in secure, and supported this with examples of rules being usual things that would happen if you were at home and activities you'd usually do in the house. However, Andy also advised they missed being at home, showing their ambivalence in how they felt about this. There was a sense of ambivalence in the way young people reflected on their relationships in the context of secure care. For example, while several young people commented on the quality of staff, they did so in the context of previous residential placements. For Bobby D, their experience of staff seemed to contradict the fear and uncertainty they felt about being secured. This challenges the dichotomous thinking, a type of binary perception of viewing things as either good or bad with no grey areas, commonly associated with autistic people, as they were able to think about their experience as both bad and good at the same time. Lindsay advised that people made them feel good and that they could talk to staff, however expressed they did not feel well understood by staff. Ziggy's ambivalence was particularly visible as they provided conflicting responses about who they spent time with, what had impacted on them, and what they would miss most, suggesting they felt uncomfortable disclosing how important staff really were to them. In contradiction to this, despite reflecting positively on some individual members of staff, Sammy referred to relationships being forced and to staff as these people get paid to care for me, as though indicating that in some way dilutes the authenticity of relationship. Despite numerous positive reflections on their experience of Secure, Bobby M showed a level of ambivalence, advising the good things sort of overrule the bad things as a way of levelling up and balancing the experience. Bobby M's ambivalence in weighing up the good and the bad may reflect the power dynamics at play in Secure, the control of their life lost through deprivation of liberty, and the control of their life gained through emotional and physical containment. Despite the positive relationships they had formed with key members of staff, Bobby D advised their experience may have been improved if staff skills had been better placed to understand autism. They reflected on the limitations of autism training. Bobby D was unsure who they wanted to know about them being autistic. This uncertainty appears to have been based on their life experience of others not talking to them once they became aware Bobby D was autistic, leading them to feel potentially marginalised or excluded. Moving into restriction now, freedom, secure criteria, symbolism, containment, and safety were all sub-themes of restriction. Some young people appear to find it difficult to make sense of their placement in Secure. In relation to the physical environment, it's of no surprise that the environmental restrictions, which deprived them of their freedom, had a significant impact on how young people conceptualised their experiences. The way young people made sense of being deprived of their liberty can be seen reflected in the language they used to articulate their experiences. It was clear there were elements of secure care practice that didn't make sense to young people. However, some young people were able to articulate their reflections around sense-making more explicitly. At a fundamental level, some young people struggled to make sense of their placement in Secure. For example, Lindsay spent a lot of time talking and asking questions about loss of freedom, perhaps finding it difficult to make sense of what this meant as an abstract concept. Lindsay had learned the Secure criteria by rote and used this to try and make sense of their admission. The notion of secure criteria can provide a helpful structured way of processing secure admission for an autistic young person, as it offers a clear set of rules. However, this didn't help Sammy, who found it difficult to make sense of why young people who can't keep themselves safe are placed with young people in conflict with the law. Andy was of a similar view that better early intervention was needed to prevent admission to Secure for young people who can't keep themselves safe. It appeared both Sammy and Andy were trying to make sense at a more macro level of the lack of congruence across these pieces of social policy and young people's actual experiences. There was an ambivalence about the way these young people were experiencing care within the context of the wider macro system, and a gap between the rhetoric and reality. Some young people made use of symbolism to support their own understanding and description of deprivation of liberty. For example, Lindsay referred on repeated occasions to the big locked doors as a symbolic physical representation of their loss of liberty. Ziggy offered further examples of symbolism which may be related to Ziggy's construction of truth as an autistic person. Due to the differences in theory of mind to the holistic population, the inconsistency of the setting may feel dishonest, with the TVs and boxes offering a symbolic concrete example of this. Concrete symbols of the environment, such as big locked doors or TVs and boxes, may be better understood by autistic young people experiencing secure care than abstract ones. Sammy and Lindsay struggled to understand the rationale for the differences between the rules they were accustomed to in a care home setting and the more stringent ones in place in a secure setting. However, Andy constructed secure rules as containment through boundaries applied as part of normal parenting, and used this to show an understanding that rules were informed by young people's risks, that as a result they helped to keep young people safe. Consequently, the restriction of certain items made sense to Andy in terms of the provision of a safe environment and the containment of young people's unmanageable behaviours. Other young people were also able to show that they understood the risks associated with restricted items, and from this perspective were able to make sense of search procedures as a containing function which helped to keep people safe. Containment in terms of the physical environment of secure was viewed by young people simultaneously as positive and negative. Lindsay expressed a sense of positive containment from the physical security of the building. In contradiction to this, Charlie constructed secure as physical containment in their use of having to be locked in rooms, which they positioned as a bad thing. Bobby M. advised that the relaxed atmosphere of secure, a combination of the physical environment and staff attitudes, helped them to stay calm and feel contained. Similarly, Sammy spoke of the sense of emotional safety that secure had provided. It afforded freedom of expression for them without fear of repercussions. There were contradictions in the environment that appeared to be experienced by young people as incongruence. Young people really struggled to make sense of their thoughts around being locked up, but feeling the safest they had ever felt. For example, Andy. For some, the feelings of safety and nurture were not ones they were accustomed to. It's likely this influenced their feelings of ambivalence. Andy was clear that they felt safe and secure, and that the rules made sense to them to keep them and other young people safe. Bobby M. largely echoed this view. Bobby D, however, recognised that secure not always, but most of the time, felt safe. This lack of consistently felt safety was sometimes connected by young people to the perceived absence of information about what was happening. In Bobby D's case, they may have felt a sense of uncertainty due to the conflicting experiences which, at the same time, helped them to feel safe and not safe. Lindsay confirmed that secure felt like a safe place, expressing this safety was found in the physical security of the building. However, they appeared conflicted in their views of the security of the building, recognising that the restrictions both kept them safe and deprived them of their liberty. Ziggy was similarly ambivalent, with conflicting responses provided at different times. When asked if secure felt like a safe place, in the written response completed with staff, Ziggy simply responded yes. However, in the verbal response with no staff present, Ziggy was able to reflect on the inconsistencies between the way the environment looked and what this meant in terms of feeling safe by drawing on the example of TVs being secured in boxes. I could feel Ziggy's discomfort with the lack of alignment between something that they were told was safe but did not feel safe to them. I can see how it would be difficult to make sense of why, if it's a safe environment, the TVs need protection by being in boxes. If we move now to structure versus flexibility, stigma, ambivalence, and routines were sub-themes that demonstrated the significance of structure in young people's lives. Societal structures and stigma played a large part in influencing both how young people viewed themselves and, where they were able to, how they conceptualised others' views of them. Sammy described finding it difficult to accept autism as a part of their identity, which is suggestive of a rejection of labelling and deficit constructions of autism. Bobby D described being physically labelled as the result of wearing a sunflower badge, which is designed to show they were autistic. Bobby D described a good understanding of their own autism and of the limited autism awareness of others. Alongside the stigma of being autistic, young people described the stigma of experiencing secure. For example, Andy's ambivalence as to how they felt about secure was seen through their use of both "I felt like I belonged" and "I didn't deserve to be there." It could be Andy had heard from others that they didn't deserve to be there as a form of stigma, which had become internalised. This was in the context of the shared experiences and supportive relationships with other young people that had created a sense of belonging for Andy and secure. Secure care was also viewed by Andy through the societally constructed punitive lens and therefore felt like a punishment. This was compounded by their previous placement breaking down, which created a dichotomy of being let down by people and systems, but then experiencing secure as a safe haven and a place that Andy fitted. Ziggy's view that they didn't belong conflicted with the sense of identifying with other young people they expressed, which alluded to a shift in their sense of belonging over time. Lindsay also showed a conflict between the construction of their loss of liberty and their view of their self as a good person who does well. This view of a good self was incompatible with the societal construction of children who are deprived of their liberty and likely created a sense of incongruence for Lindsay. If secure care is seen as a place for bad kids, then it may create an illusion for young people living there that they are therefore bad. For those who felt a sense of belonging there, that sense of being bad may have been even stronger. The ambivalence of how they felt about their time in secure can be seen in both Sammy and Andy's responses. This may be reflective of the wider societal ambivalence around residential childcare and the locking up of children, as seen through the attitudes of policymakers and the public. These young people's experiences are symptomatic of the tensions between care and risk. Other young people expressed ambivalence over how they felt about the rules in secure. Bobby D's ambivalence was such that they were unable to offer any detail in either a positive or negative manner, perhaps because they were simply unable to make sense of the experience. Ziggy advised that whilst they understood why the rules were in place, they found them to be unfair and unhelpful. This inability to make sense of certain rules shows an ambiguity which was echoed by Bobby M, who reported there weren't really any rules they didn't understand, but then contradicted this by saying one that I'm a bit hazy on. Ambiguity appeared to be addressed where young people had a better understanding of the rationale behind the rules, even if they didn't feel applicable to the young person as an individual. A key thread of young people's reflections on what they found helpful about life in secure were the routines. In the context of this research project, this bears particular relevance when viewed through the lens of autism, due to autistic people's reliance on routines and resistance to change, and may have helped young people to make sense of daily life in secure. In contradiction to the other young people, Ziggy expressed a dislike for the routines. They did this in an implicit way, through their tone and facial expression, rather than explicitly through the words they used. It may be that Ziggy experienced the routines in an ambiguous manner, if they seemed unclear or open to interpretation. Ziggy went on to acknowledge that they were less stressed due to the impact of the sameness of the routines, which echoed others' responses. Importantly, Ziggy advised they didn't have any of their own routines, which meant the structure imposed on them by secure life was a new concept for them, but one which appeared welcome. Individuality, inconsistencies, macro-level inconsistency, blanket rules, injustice, and age were all sub-themes of flexibility. A recurring aspect of the rules was the element of flexibility in terms of the implementation of policies and procedures. For example, Bobby D advised that they were able to keep their own rules for things that were important to them most of the time whilst living in secure, whilst Andy recognised the individuality of environmental restrictions and that these were dependent on young people's ability to demonstrate their level of regulation. Andy acknowledged the complexity of having different rules for different young people. When the rules in secure varied to take account of individual young people's needs, this felt inconsistent to young people participating in my research, which they then deemed to be unfair. Some young people were developmentally better placed to make sense of this than others. For example, thinking about whether the variation in rules was fair, Bobby M was able to rationalise this. Whilst Bobby M acknowledged that the rules were rigid, they recognised that they could vary for individuals. This suggested that either there was some flexibility in the rules dependent on the individual young people's risks, or that there were inconsistencies in the way the rules were applied by staff. The latter is suggested in Bobby M's use of one person interprets one thing different to another person. There was an ambiguity in the way young people received the rules, where it seemed to them that the rules were unclear or open to interpretation. Andy observed that some rules in secure were fixed, such as certain items that were not permitted, but noted that some staff were more rigid with the implementation of these rules than others, which evidences possible inconsistencies in practice. Ziggy offered a stronger view, clearly stating that they saw inconsistencies in the level to which rules were enforced, depending on who was on shift. Bobby M noted that the inconsistency in implementation of the rules could be confusing, and for Sammy, the inconsistencies suggested a reduction in felt safety, as they didn't like, and therefore didn't approach, the staff they identified as being inconsistent for support. Young people's accounts reflected a more macro-level inconsistency of practice across the secure sector. Both Andy and Ziggy noted inconsistencies in the environment and procedures of the secure estate. This is significant when considered in the context of readmission rates, as inconsistencies of practice at a macro level means that any experiential benefits will be limited for young people moving between services. In contradiction to the benefits of standardisation of practice is the flip side of policies and rules being applied indiscriminately, known as blanket rules or restrictions. It could be argued that these offer consistency of practice, however they fail to take account of individual risks and often restrict a person's rights, including their liberty. Lindsay gave 3 clear examples of blanket rules in relation to kitchen access, internet access, and the use of earphones. Like Lindsay, Bobby M used a specific example to illustrate their point about blanket rules in the secure setting. Lindsay reported that they hadn't been able to explore the rationale for blanket rules with staff, and Ziggy's response suggested there was no route to challenge existing rules. In a similar way to Bobby M, Ziggy also spoke on behalf of other young people using we rather than I. Ziggy's view of unfairness of overly strict rules was reiterated by Sammy, who expressed a sense of injustice in having the same rules for everyone. Their sense of injustice may be related to their status as people society views as different. They may be learning, for example, in Sammy's perceived disproportionality in the unit's responses to harm to self, which led them to feel overly restricted. Bobby M and Ziggy were of the view that rules should be changed. Bobby M advised rules could be better informed by young people's age and how much support they need, for example, if they have a disability. Other young people seem to have particular difficulty with the bedtime rule, such as Charlie. Ziggy reported that the bedtime rule didn't make sense, and Bobby M expressed concerns about insomnia and reduced autonomy. Sammy also expressed concerns about the lack of flexibility based on young people's age. However, Sammy's example related to wider systemic issues. Here, Sammy was talking about being forced to leave secure due to their impending 18th birthday, despite an alternative suitable placement not having been found. That takes us on to nurtured versus scared, and food, sensory, well-being, culture, staff relationships, and individual staff were all sub-themes that illustrated nurtured. Feeling nurtured can be symbolised in several ways, one of these being through food. Whilst preparing food is a literal activity of care, food is also a symbol of being well cared for, and quality food experiences are often deemed to be significant in creating a nurturing, containing environment. It's of no surprise then that food was a key theme for several young people. Ziggy described the food as rubbish and wanted to change this. Ziggy felt there was a lack of choice and restricted access to food at particular times of day. Limited access to McDonald's food was a key concern. Food is a symbol of belonging, tapping into young people's memories and sense of identity. It may have been this and the restrictions around choice and access to food that created the significance for Ziggy, particularly if visiting McDonald's was an experience they associated with being cared for when they lived at home. Bobby M was overwhelmingly positive about the quality of food and secure. In the context of talking about feeling nurtured in a caring environment, Bobby M advised that the food's nicer as well. Bobby D advised that the food was not good compared to where they lived before, and that the food comes in a big yellow trolley from the kitchen. Bobby D made use of symbolic physical representation here of the food not being good. This is coupled with a sense of being othered through the stigmatising, institutionalised way in which the food arrived. Another way in which young people constructed how it felt to be locked up was through the sensory impact. This may be specific to autistic young people due to their differing sensory needs from the holistic population. Andy recalled the noises from their day of admission being significant, which were perhaps a symbolic representation of feeling locked up and the fear they felt that may have been exacerbated by sound sensitivity. Ziggy recalled the very specific sounds of the garage door. Alongside this, Ziggy recalled from the day of their admission a strong smell of bleach or disinfectant. When reflecting on others' autism awareness, Bobby D described how their own sensory needs varied daily depending on arousal levels, which made it harder for others to understand. In contrast to this, Bobby D reported a positive sensory experience from their day of admission. The experience of showering in a very, very nice shower and simultaneously becoming clean by washing away the blood and dirt could be viewed as symbolic of being cared for. It also offers a potential therapeutic blue space experience. The benefits of time outdoors in green spaces and physical exercise and their subsequent impact on physical and mental well-being have been widely researched in relation to children, autistic people and the population more widely, although related challenges for secure services are clear. Bobby M advised that they miss being outdoors in the fresh air in the countryside. It's possible that access to the outdoors may have enhanced the feelings of calm that Bobby M reported benefiting from. Sammy described limited access to the outdoors and fresh air. Similarly, Andy advised that the limited access to exercise or other preferred activities in secure was difficult. Despite access to physical equipment such as a swimming pool, the ability to physically use this appeared to be dependent on others, which limited Andy's free choice. Ziggy articulated concerns about the lack of availability of a particular piece of exercise equipment, which may have had sensory implications for them. Ziggy expressed finding a sense of peace in the garden, which may have been a reflection of the sensory overload of the internal environment. Bobby M reported that the environment of Secure was nurturing and helped them to feel cared for and protected, and that they were not bored or deprived of things to do. It appeared their identity could continue to develop as they could take part in activities that interested them. This in turn helped them to feel known, understood and valued, which created a sense of nurture. In contrast to this, both Ziggy and Sammy reported being bored. The significance of culture in residential childcare settings is widely understood. In this research project, young people articulated the presence of a positive and supportive culture in Secure. To some extent, Ziggy was able to describe the way in which people impact on culture in creating the atmosphere and informing how the environment feels. Andy described the sense of community and nurture they felt from the Secure unit. The Secure unit appeared to feel more nurturing than the community setting for Andy due to the staff presence. Similarly, Bobby M suggested that the increased number of staff in Secure helped them to feel safe, possibly due to feeling that others were looking out for them and helping them to feel cared for. The way in which Andy described Secure care as not being for bad people, just people that are struggling, is likely reflective of a service that has created a shared narrative that promotes a more empathic culture of mutual understanding between young people. However, Andy's experience in a community setting with the same provider seemed to be of a different culture. Therefore, despite overarching organisational policies, it seems this culture was specific to the Secure service, perhaps due to the influence of an individual leader. Most young people, except for Lindsay, advised that they felt well understood by staff relationships in Secure, and noted that the quality of staff was better than that they had experienced previously. It is understood that autism impacts on the development of relationships, and some young people like Lindsay appeared to find reflection on relationships difficult. However, people were a key theme of many young people's responses when reflecting on their time in Secure. For example, Charlie noted they had experienced good, consistent relationships. For Ziggy, people were a significant feature of their memory of their first day in Secure. It may be this element of the relational connection young people found beneficial as they developed a sense of belonging and feeling loved. Where autistic young people feel accepted and connected with the relationship offered, the ways in which autism is understood is just one element of this, as autism is just one element of their identity. For some young people, it was specific individual staff who had made the difference, rather than the staff team as a whole. Sammy described the importance of some, but not all, current and previous staff. Sammy connected this to feelings of safety and what can be interpreted as containment from staff. Similarly, Bobby D reflected on the significance of some safe staff and 2 young people, advising that they helped. Andy highlighted the importance of relationships when describing how it felt to be supported by their preferred people. Although Andy couldn't find the words for this, I had the sense it made them feel valued and enhanced their sense of self-esteem. Fear, stress, admission, and frames of reference were sub-themes that reflected young people's experiences of being scared and secure. The extent to which young people interpreted experiences as nurturing was influenced by how individualised they were. The start of young people's placements was particularly difficult, as they had limited experiential or other information on what to expect, resulting in them feeling scared. The sudden removal of their normal daily routines coupled with the addition of an unfamiliar environment, appeared to create an increased sense of fear. Bobby D believed the fear was due to people not telling them what was happening. This relates to sense-making, with the lack of information available meaning Bobby D could not make sense of their experience. It's likely any sense of fear was compounded by being in the presence of people who were not known to young people. Bobby D described their arrival in Secure as being scary because there was a lot of new people. It's likely this feeling of being surrounded by new people would have reinforced any sense that Bobby D had of himself as not belonging, a view commonly held by autistic people living in an holistic society. For some young people, the level of stress created by admission to Secure appears to have made it difficult for them to process or retain information, with both Sammy and Charlie advising that they didn't remember their first day, and Lindsay struggling to recall being searched. It appeared Lindsay was unable to remember exactly how they felt, with the use of, "I was probably scared." This may have been due to a level of overwhelm that made it difficult to process or retain information, including how they felt. These stressors can be experienced as mini traumas and have cumulative impact on young people's well-being over time. There was an experiential element to Bobby M's reflections on the search procedures for admission to Secure. Other young people were able to articulate the importance of understanding the rules and daily routines by saying it would have been helpful to know this prior to admission and that they hadn't had this information. Lindsay advised that the lack of communication at the point of admission meant it had been difficult to understand what was happening and had impacted upon how they felt at the time. In their use of how it works, it seems to me that Lindsay is articulating that there is a framework, a script of sorts that they have not had access to. Similarly, Bobby M referred to this as the structure of the place. This framework of rules offers answers in some respects that would support young people to make sense of why things are the way they are. There are strong parallels here with the way autistic people experience the social world, with its unwritten, unexplained rules which are often difficult to make sense of. This is an aspect of practice that is applicable to all residential childcare settings, but may be especially important for autistic young people, given the significance of routines. Through familiarity of alternative living environments and their associated procedures, subsequent Secure experiences became easier for young people to make sense of. Lindsay drew on their previous experience in other non-Secure residential settings to try and help them make sense of their Secure experience, making comparisons and citing differences. Ziggy, who like Lindsay didn't have a previous Secure experience to draw on, indicated that there was an element of becoming accustomed to the situation that made their stay in Secure more manageable. The experiential element of this may relate to their lived experience being their truth as an autistic young person. Andy also reflected that settling into a Secure unit can be dependent on age or previous experiences. It's likely the second experience of Secure for Andy was informed by the first, as they had that experience to draw on. As an autistic young person informed by experiences, this may have meant Andy was better equipped for, and therefore benefited more from, the second Secure placement. And the final theme, belonging versus loss. Group shared experiences and masking were sub-themes entwined with belonging. In thinking about some of the difficulties, Ziggy reflected on the impact of living with other young people who may often be dysregulated, and how this could result in something similar to a group sanction. Similarly, Bobby M advised that other young people's behaviours could impact on their experience, or that daily life could be unpredictable due to others' behaviour. This challenges some of the dominant theories of autism and how others' emotional experiences are understood. Both Andy and Ziggy had a similar way to each other of categorising people, which may have been a way of trying to make sense of their behaviours and make them more predictable. Within this, Andy demonstrated an awareness of how other young people were feeling, appearing to offer a sense of empathy as to why they might be behaving in that way. Bobby M also demonstrated empathy for staff and their expression of concern that not all young people respected staff. This was interesting, as empathy is not often associated with autistic people. However, the autistic empathy deficit narrative has been challenged more recently by research, which found a high proportion of hyper-empathy amongst the autistic population. Like Andy, Ziggy divided people into two types, although separated out the types for adults and young people. Interestingly, Ziggy didn't see themselves as fitting either of these categories. This illustrates a sense of their self as being different from others. Sammy advised they hadn't done much group living prior to living insecure, and they found this new and strange. Sammy noted a lack of friendship with peers insecure and that they were forced to live with people I don't like. Andy advised their behaviours had been influenced by the young people they had lived with insecure, and that they had learned coping strategies such as swallowing batteries from others. Andy appeared to have internalised this in a way that impacted on their identity. It's possible the significance of shared experiences, including a sense of shared trauma, had in some way supported Andy's healing despite risks caused by the batteries. While some young people articulated a sense of belonging with the group or secure community, others, such as Sammy and Bobby D, expressed a feeling of not belonging. Bobby M echoed this, although recognised they had been in worse places. For Sammy, the sense of being an outsider seemed to be enhanced by the mix of young people they were living with who were placed on both welfare and justice grounds. Young people articulated benefiting from a sense of community through shared experiences with other young people, potentially reflecting the importance of being with your own tribe or blending in. For example, Ziggy described young people sticking together. They rationalised this as being as a result of living with others who'd had similar experiences. In thinking about their own dysregulated and self-injurious behaviour, Andy echoed Ziggy's reflections on their similarities with other young people. There's an argument to be made that autistic people better understand autistic people than those who are allistic. For example, with regards to lack of social motivation. It may be that the experience of living insecure offers a comparable intensity of shared experience to the shared experience of being autistic. It seemed to me that seeing ourselves reflected in others validates our identity and increases our sense of belonging. When we're part of an intersectional minority, the chances of us finding this are decreased as the numbers of people who represent us are lower. Sammy described changes in the way that they interacted with others in order to make the experience of living insecure more manageable. There was a suggestion that the identity management adjustment in their own presentation impacted on their sense of self. Identity management behaviours such as masking increase in correlation to autism-related stigma, with a resulting impact on identity such as pressure to conform with holistic social conventions or a loss of acceptance of self. Ziggy also alluded to a sense of masking or non-compliance to make life easier, while Andy described literal masking in relation to their appearance using heavy makeup. Bobby M demonstrated an understanding of being able to change their behaviour depending on who they were around, which may be another example of masking behaviour. Andy demonstrated ways in which others' perceptions of their self and identity influenced their own view by drawing on descriptions they had heard of themselves. It may have been that Andy was trying on these masks to see if they fitted, or finding out about themselves through the eyes of others. Similarly, Bobby T appeared to have internalised others' views of them as an autistic young person. It may have been difficult for congruence to be provided in a context of people presenting fictitious versions of themselves. For autistic young people with differences in theory of mind, this may increase feelings of incongruence or create a sense of felt dissonance. It's known that dissonance increases masking behaviour in autistic people. Family, staying connected and change were sub-themes relating to loss. The theme of loss was key for most young people. Sammy described reduced contact with family and friends as a result of living insecure. Sammy was unable to have any contact with their pet, which they described as the most important thing to me. Andy also described the loss of connection to their family and pet and how difficult it was not to be able to see them. The weight of this loss is reinforced by Andy's use of, "It just feels like everyone's leaving me." Bobby M spoke of how difficult it felt for them to be away from their family, and that this was the thing that had the biggest impact on them. However, not all young people mentioned missing their family, such as Andy, Bobby D, and Charlie. The displacement from home communities called young people's identity into question, as it would for any of us. Being immersed in different accents, eating different foods, seeing different sights, and listening to different sounds because of living somewhere different can lead one to question if one is still the same person. All the senses are implicated, which has enhanced consequences for autistic young people who may experience the world in a heightened sensory manner. Enhancing access to sensory language may help to reduce the communication barrier. Music, for example, can access memories through its direct connection with the hippocampus, and smell has a straight route to the hippocampus and amygdala in the limbic system. so connects directly with emotions and memories. Sensory experiences therefore offer the kind of opportunities for young people to connect with a more authentic sense of themselves, build more positive identities, and may reduce the sense of displacement. Further losses were experienced as young people transitioned out of secure. Such was the positive impact of support Andy had received from the secure unit. They felt a loss now that they no longer lived there. Andy described how difficult it had been to stay connected to significant people since leaving the secure unit. There was a sense from Andy that it was important to be able to maintain these connections, but much of this was not in Andy's control. Bobby D identified that particular members of staff and two key young people in secure were important to them, and this was who they missed the most once they had moved on from secure. Whilst relationships with staff were able to be maintained to a certain extent post-secure, this was not the case with the young people. Whilst this is understandable from a risk management perspective, it creates an additional layer of complexity for young people moving on from secure if they can't maintain important relationships with peers. Sammy recognised that some new relationships formed whilst insecure, particularly with key members of staff, had had a positive impact on their life. Sammy articulated a sense of emotional felt safety from one member of staff in particular, in emphasising the feeling of trust and relational importance of them in their life. This relationship was of particular significance as it had been maintained since Sammy moved on from the service and may have positively impacted on Sammy's own self-esteem. There were conflicting views from young people over the benefits versus the drawbacks of being an unknown at the point of moving into secure. For Andy, there was a sense that it was important to be around people who knew them. In this context, it was significant that Andy described how other people didn't know anything about them other than their gender before they arrived in secure. Bobby M, on the other hand, positioned being unknown as a fresh start in a new environment. This appeared to lead them to construct secure as a transformative experience with our use of the step forward this has given me to better myself as a person. Similarly, Bobby D's reported positive sensory experience from their day of admission of showering in a very, very nice shower could be viewed as symbolic of washing clean as a fresh start. In contradiction to this, Sammy articulated a sense of stuckness and inability to change. This may have been in relation to adolescence or rigidity linked to autism. It may also have been related to Sammy nearing the end of their time in secure and therefore the fresh start narrative feeling of less relevance for them, showing how young people feel about belonging in secure could shift over time. The space and time to think alluded to by Ziggy, who spoke of benefiting from the peace by sitting and relaxing in the garden. Ziggy was able to reflect that things were easier now and that they were calmer and less stressed due to the impact of secure. It may be that young people were drawn to the narrative of a fresh start because they needed this narrative to cope with their time in secure, or were reflecting a narrative given to them by others. However, it seemed to me that for some participants, their time in secure really had been life-altering. So I'm sorry, I'm watching the clock and trying to speak really fast. That takes us on to the recommendations, and the recommendations are structured around the conceptual framework I used of relationships, residence and rules. I want to just recognise that given the time since the research was carried out, some services might already have begun to take account of some of these areas of practice that I'm going to cover. So starting with the recommendations in relation to relationships. Whilst arriving as an unknown offered the possibility of a restorative or transformative experience, becoming known enabled the positive development of more authentic identity. Whilst the research focused on autistic young people's experiences, it's likely this is true for the broader population of young people experiencing secure. It's therefore important that we consider engaging with young people in ways that enable them to feel known, whilst taking account of their communication preferences. Whilst it's recognised that secure will be a difficult experience for many young people to process due to the nature of being away from their family and deprived of their liberty, for autistic young people there are particular challenges in making sense of ambivalent experiences due to a reduced capacity for cognitive dissonance. Therefore, secure should aim to offer autistic young people an experience that feels less ambivalent by ensuring that individual needs are appropriately met. It may be that opportunity-led or life-space work that helps young people process contradictory emotions and experiences would be of benefit in supporting young people to develop a more authentic identity, particularly if delivered in a sensory or holistic manner. Where autistic young people had the opportunity to benefit from shared experiences, there was a potential for young people's enhanced belonging and connectedness with their tribe. This is of particular importance for autistic young people who may have had limited opportunities to feel like they belong, and offers an opportunity for inclusion to be reimagined. Therefore, it's crucial we give cognizance to the significance for young people of belonging to the group when making decisions about admissions. This might be given consideration through admissions assessments, the way units are structured, and how staff support engagement between young people. Notwithstanding the fact that what is known about hyperempathy in the context of autism is still emerging, it's likely the high levels of trauma present in Secure increase autistic young people's own levels of dysregulation and distress. Going forward, we should consider how we can mitigate the potential impact of hyperempathy and any associated distress in autistic young people. This may be through admissions and matching decisions, risk assessment and care planning, or the consideration of appropriate interventions to respond to dysregulation and distress. Moving now into the recommendations in relation to the residents, which is the environment. This research project has supported our developing understanding of the significance of attending to semiotics in the design of the environment. Going forward, we should continue to give increasing consideration to these factors in environmental design through a more congruent use of symbolism. This might mean ensuring that food is presented in a manner that looks and feels nurturing, that the latest technologies are utilised to limit the requirements for secure fixtures, and that environmental symbolism is given consideration more broadly, for example, to support communication needs. Whilst of particular significance for autistic young people, there are likely benefits here for the broader population of young people experiencing Secure. The potential implications of masking for autistic young people were recognised in this research, with masking being a form of impression management that operates under normalisation principles of power and exclusion. There's a resulting impact on developing identities. Therefore, any work undertaken to develop secure care experience young people's developing sense of self must challenge any internalisation of imposed stigma. This may be in relation to autism, other minority aspects of young people's identities, or the intersection of these. It's recognised that environmental conditions that reduce autism-related stigma, and therefore the perceived need for masking, may support the development of an authentic identity. This may be a useful consideration for secure settings, particularly the significance of attending to sensory experiences in a secure environment. Giving ever-increasing cognizance to sensory experiences should include consideration of acoustics or soundproofing, varying lighting, escape spaces, and careful use of colour and pattern. Whilst of particular significance for autistic young people, there are likely benefits here for the broader population of young people experiencing Secure. Along with the sensory impact of the environment, the significance of autistic young people's sensory language was discussed. Maintaining young people's sensory connections to their identity during their time in Secure may reduce the sense of displacement, and enhanced access to sensory language more broadly may help to reduce any communication barriers. Secure centres may benefit from considering ways in which access to all young people's sensory language can be enhanced. Through consultation with young people, this may include, for example, consideration of food, music, or environmental smells. And finally, the recommendations in relation to the rules. Due to the significance of dichotomous thinking for autistic people, it's crucial that future practice is attuned to autistic children's paradoxical experiences of Secure. This means that any associated uncertainty and resulting anxiety should be reduced to a minimum. Autistic young people should be given additional support in making sense of ambiguity. To do so would offer a parallel process to that of dichotomous thinking and would support increased cognitive consonance. Much is already known about the significance of routines and structure for autistic people, with their presence providing a sense of predictability and safety. We should contemplate how important information such as daily routines and rules is communicated to young people. This may include consideration of what information is able to be shared with young people prior to admission, and the range of accessible communication styles utilised to share this information. For example, photos or videos of adults, rooms, the building and the grounds. Whilst of particular significance for autistic young people, there are likely benefits here for the broader population of young people experiencing Secure. The provision of coherent rules is known to provide a sense of predictability and safety for autistic people. However, it may be that insufficient weight is given to how rules are experienced by autistic young people, instead giving weight to other presenting characteristics. With the increasing prevalence of autistic children in Secure, greater cognizance may need to be given to the ways in which autistic young people experience the rules. This could be done through consultation with the autism community. It's recommended that the implications of autism for each individual young person be attended to and reflected in care planning. Several young people who have participated in this research reflected on the impact of blanket restrictions. Whilst recognising the significant importance of risk management in a secure environment, consideration could be given to further individualising risk management strategies. Alongside this, risk assessments or behaviour support plans could be used to detail the strategies young people find soothing when distressed and identify steps to mitigate any associated risks. Whilst of particular significance for autistic young people, there are likely benefits here for the broader population of young people experiencing Secure. And that brings me to the end of that whistle-stop tour.
Hey Charlotte, on behalf of everybody who came along today for that really dense presentation, loads of information and people in there for people to go away and think about. And Charlie has already put a couple of links within the chat that people might want to go and look at. And also pointed towards the CYCJ practice guide, which Sally's about to put into the chat, which might be somewhere for practitioners to go to with any issues. We're really pushed for time, so can I just flag up the following? The e-learning platform of CYCJ is now launched, and we have in the pipeline a module all about neurodiversity, which might be of interest to you. And our next webinar is in a couple of weeks' time, looking at the impact on COVID has had upon children's development and whether or not that should impact upon age and responsibility. For the sake of time, Charlotte, if you could probably just ask these two, I'm going to ask a couple of questions to you. One, and I know that can you just confirm you were speaking to children who've been diagnosed or were believed to have autism, is that correct? And did you have any sense from what your research, whether or not the findings that you've found would be different amongst the non-autistic population?
So I didn't carry out a comparative sample. Looking at existing research for Secure, and there's been quite a lot, as you'll know, Ross, it did appear that some of the findings were very specific to autistic young people, but it would be a suggestion for future research to, potentially carry out that kind of comparative study.
That's great, thank you. And I've got a question from a colleague who works in the NHS. From your understanding, and perhaps some of the participants alluded to this, were there any differences in the way the autistic children experience secure care compared to how autistic children experience other services such as residential care, CAMS, FCAMS, inpatient units and so on?
Yeah, so obviously as part of my research, I carried out a literature review and looked at a lot of the existing research in other secure settings. A lot of that is focused on adults, as I said at the start, justice settings and mental health settings, secure hospitals, for example. But there was certainly a lot of similarities, a lot of read across in terms of the findings of my research and existing research in other secure settings.
And finally, Charlotte, I'm not sure if you're going to be able to answer this question. I'll ask it anyway. I know you were using gender neutral terms throughout the presentation, and we've got a question. Was there any sense of any differences in experiences of secure care between sex, but I suppose just as important that amongst gender, from the children who took part in your study?
There wasn't, no. No, it was
Okay.
there was a mix of genders, but there wasn't any sort of noticeable differences in terms of the findings relating to gender or sex.
Okay, that's great. And I suppose now that you answered that one so quickly, I'll just pose one that was off the top of my head. Was there anything in there about neurodiverse staff and how, if children were aware of neurodiverse staff amongst the pool of people that were caring for them, and whether or not that was something that was commented on by the children?
No, that's not something that came up at all, actually. There were specific members of staff that young people felt a connection with and reflected on the importance of those individual relationships, as I said, but whether or not they were neurodiverse, that wasn't something that either young people were aware of, or if they were aware, didn't feel it was important to mention to me.
Okay. Well, thank you so much, Charlotte, for answering those questions and for the really thorough presentation you gave. I'm sure that the content of what you provide is food for thought for people, particularly with the consultation regarding the government response to Reimagine Secure Care coming up later on this year. I think there's loads of things in that you've surfaced there that might be of significance to people's thinking about secure care, or how we respond to the needs of children with autism who face, make or take the highest levels of risk in the future. So thanks very much for raising that. Time's getting past beyond the 1 o'clock now. People are starting to drift off. So I'll just thank everybody for coming along. Hopefully see you at our next webinar on the 8th of December. And if I don't see you before then, have a nice Christmas and New Year. Thanks a lot, Charlotte. Thanks, everybody.